A patient will get referred to a provider who does the high-intensity focused ultrasound, such as myself. We will see the patient in clinic, and then we'll order a couple of imaging studies. The first will be a head CT. The head CT will be done to calculate the skull density ratio, or how thick the skull is. We have to make sure that the skull is thin enough for that energy to be able to pass. We will then do a brain mapping MRI. The brain mapping MRI is to personalize the approach to the patient's anatomy. Once the patient has had the head CT and the MRI, they're scheduled for treatment. The week before the procedure, the patient has held all of their tremor medications. They have also held any anticoagulation medicines. They come in on a Monday morning and they're first met by myself and a movement disorder neurologist. We do a full neurological exam to evaluate the extent of their symptoms off medications. Once that is complete, we will give the patient some medications before the procedure. We do this procedure at Clements University Hospital. This is typically an outpatient procedure where the patient comes in the morning and goes home at around 2 o'clock in the afternoon. We will start by placing a stereotactic frame or a plastic frame on the patient's head. The purpose of this frame is to keep the patient's head still during the treatment. Once the frame is in place, we'll put the patient on the MRI scanner. We'll put a water bag that circulates cold water over the patient's scalp during the duration of the treatment. The purpose of this cold water is to keep the skull and the skin and the scalp cool during treatment. We will do a real-time 10 to 15 minute MRI scan. We will take that MRI scan and then fuse it to the preoperative brain mapping MRI. In real time, we will know where the target is and what parts of the brain we want to avoid. We will start by administering low-intensity focused ultrasound to the target. The patient will be evaluated and made sure that the tremor is getting better and the patient is not having any other side effects. The patient is awake on the table, and as we're administering the low-intensity focused ultrasound, myself and the neurologist are continuously examining the patient. We will then increase the energy and treat 2 to 3 times. This part of the treatment will take 15 to 30 minutes. The positive outcome is actually happening in real time during the treatment. We watch as the patient's tremor diminishes and then is gone. The patient will be brought out of the MRI scanner, the frame will be removed, the water bag will come off, and the patient will be in recovery for 2 hours.